Hello everybody, welcome to this evening's Facebook Live. Do apologise, we did start at 7 but we hit some technical glitches, not quite sure what's going on, but we've restarted. I don't think we got very far, so apologies for that. We'll go through the questions again that we'd started going through. I'm joined by my colleague Katie.
Hello.
We're both nurses at Breast Cancer Now. Just to remind everybody, do put your questions in the chat, and do post your questions, and whatever we can answer, we'll get through. We'll get through this evening. Anything that we don't get to, we will post replies to tomorrow morning. Do remember our helpline, 0808 800 6000. You can always give us a ring when we open tomorrow at 9, or you're very welcome to ring us this evening and leave a message for us. And the nurse at breastcancernow.org is the nurse's email address, and we've also got a web submission form and a section on our forums for asking the nurses a question. Do bear in mind this is a live event, so and it is a public event, so whatever you put up and whatever questions or comments you put up, it will be seen by other people. So hopefully we won't run into any more problems with the tech side of things. So what we're going to do is we're going to head straight into the questions that we've had. And one of them, which is one that we're asked a lot on our helpline and the Ask Our Nurses service, is about breast screening, and it's from Fiona. And Fiona has asked, why does breast screening stop at 70? Katie.
Thank you, Jane. And nice to see everybody. Thank you all for joining us and for bearing with us this evening. Yeah. So Fiona, this is a question that we do get asked quite a lot about breast screening and why people stop being called for breast screening at 70. Anybody over the age of 70 can continue to have breast screening, but they won't get the invitation anymore after you turn 70. And that's because you're weighing up the risks and the benefits of potentially detecting a cancer or something that isn't going to cause you potentially any problems in your lifetime. However, we do know that with breast cancer, the risk doesn't go away as you get older. In fact, it's the reverse. As you get older, the risk of breast cancer increases. So you are very much able to request a mammogram after the age of 70, and you just need to phone your local breast screening unit and ask for that, and you can continue to have your mammograms every 3 years. And you're called for screening routinely. You're invited from the age of 50 to the age of 70. But when we say from the age of 50, it can be, because you're called every 3 years, it could be 50. You could be 53 before you get your first mammogram request as well. So it's worth being aware of that too. Is there anything else that you wanted to add there, Jane?
Just really that there is a trial looking at increasing the age range of screening. So like you say, Katie, at the moment it's 50 to 70, but the Age X trial is looking at extending that age from 47 up to 73. And we're going to get some early results for that next year. I believe it's towards the end of next year, 2020 to 2026. But sort of full results, complete results won't be available for another few years yet, but it is looking like you say, Kate, at that benefit drawback ratio of extending the age of inviting somebody for screening mammograms. And just the other thing to be mindful of is to it's really important to remain breast aware between screening appointments. So even if you've got a breast screening sort of coming up in a few months, or if you've had a breast screening mammogram quite recently, if you do develop a change, it's important to report that to your GP, because having breast screening, it's a very reliable tool. It's a very robust way of knowing and picking up those early changes. But we do see some women do develop what we call these interval cancers. So you may develop a problem between screening appointments. So it is important to report any breast change to your GP, regardless of how recent you had a mammogram or how soon you've got one coming up.
Absolutely. And yeah, screening doesn't sort of replace um, being breast aware at all. So it's just as important to be breast aware. And that's for people also under the age of 50 as well as over the age of 70 too. Um, so
Yeah, we've got
gosh,
quite a bit of information on our website, our health information, which is our touch, look, check, and our signs and symptoms. So it isn't just a lump to be aware of. That is the most common symptom of a breast cancer, and obviously there are other breast changes that can happen. So benign conditions can affect the breast. So benign, they're not cancerous. And they can present, all of these things can present in a different way. So it's not necessarily just a lump. It might be a nipple change, an inverted nipple if your nipples aren't normally inverted, or lump in the armpit, skin changes, tethering. Sometimes nipples do,
discharge as
yeah,
well from the
discharge. You
nipple.
can have
Yeah.
nipple discharge. Um, with pain, because we also get asked quite a bit about breast pain, because obviously that's very common in all women, especially women that are premenopausal, so are having their periods still and their monthly cycle. But you can still get breast pain after the menopause. So we know that breast pain on its own is not a typical symptom of breast cancer. But again, anything you're worried about, don't be afraid to speak to a GP or somebody, one of the, sometimes nurse practitioners can help as well with breast changes. So it's just really getting to know what's normal for you,
Yeah.
what your
And
breasts
there's
look and
not a
feel like
right or a wrong
normally.
way to examine yourself either, is there, Jane? So, I mean,
No.
we do say to examine all of your breast tissue, and that does extend up to your collarbone and under your armpits as well, and just to do that on a regular basis. So, we would never sort of stipulate or prescribe how often you need to do it or what method you use to examine yourself, because it's very personal and it's whatever works for you. But it's just knowing what you look like and feel like normally, and that can be while you're in the shower or while you're lying in bed or whatever whatever fits in with your lifestyle, really. And just getting into the habit of knowing what your breasts look and feel like
Yeah.
normally. And so that way you'll be much more aware if anything was to change and be able to report it.
Yeah. Sorry, sorry
Okay.
about the dog. I think he's
Oh,
heard a
dear.
fox. Sorry about that. Um,
So there were some
right.
more questions coming in.
Yes.
So if we can move on to what Alice has said, she's sent in a question which is quite topical, and it's something that's been in the news quite a lot in the recent months. About I've been told I have dense breasts. Can I have more frequent mammograms?
Okay. So I hope you can hear me all right. I'm sorry about that noise. Um, yes. So breast density is something that's very topical, and it's something that a lot of women worry about because they may think that they've got breast density or increased breast density. You'd only ever know that your breasts were more dense if you had an imaging and you were told that. So Alice, because you said because you say you've been told, it's quite possible that you know that because you've had some sort of imaging and they know that you've got denser breast tissue. And we know that breast density is a risk factor for breast cancer. What what we don't have at the increased mammograms for women that do have breast density, but there are trials looking into that. So stratified breast screening. So we already have women who are at a higher risk because of, say, their family history, and they've got a significant family history, or they may have an altered gene. So they will be having more regular mammograms or possibly MRIs, but women with breast density don't yet, because we don't yet know the best way to do that surveillance, how frequently, and exactly what that would look like. But it is being looked at, and it is being researched and studied, so we will know. Again, it does come back to making sure you're breast aware and checking your breasts, like Katie explained, on a
Yeah.
regular basis. And just, do report in any concerns that you've got. But it might be one thing that you want to give us a ring and talk through on the helpline, and we can go through some of those sort of research studies and what exactly is being done in more detail for you, if that would be helpful. We've got a section on our website about risk, so the other things that increase risk. But yes, we do know that having sort of higher breast density does increase the risk of breast cancer. But as yet, we don't have a surveillance program specifically for women with high breast density.
Yeah. Which is why you're not necessarily in the UK told whether you do have dense breasts or not. It's not always reported. I know in
No.
other countries that can be reported, but because there isn't a procedure of how you would follow that up at the moment, and there's not a standardised sort of agreement on how that would happen, it's not routinely reported. You might be told if you ask, but you may not be told otherwise.
No. Absolutely. Okay. Hopefully that answers that question. But like I say, anything, just do pop it in the post for us. Do post some for us, and we'll get to whatever we can as well. So, June has asked about a small lump in my armpit. I have a small lump in my armpit, but don't want to bother my GP. What could it be?
Oh, June. We hear that a lot, don't we? I don't want to bother my GP. I don't want to be a problem. I don't want to waste an appointment. But absolutely, it's not wasting an appointment. If you've noticed something that's new for you, and lumps in your armpit can be a number of things. So it could be that it's a lymph node under your arm, and you have lots of lymph nodes in your body, and there are lymph nodes under your arm. Sometimes they can come up with signs of infection. It could be that it could be a number of benign changes, but it's difficult to know that until you're examined. So if you've noticed anything, and this would always be our message to anybody that notices anything new or anything different in their body, in their breasts, always get it checked out. So your GP would be very happy to see you to examine that lump and see what they think it might be. And if they feel that you need further assessment, they can refer you to the breast team for an assessment clinic, which would involve an examination by a breast specialist, potentially mammograms and ultrasounds of that area as well. And sometimes they do a biopsy as well if they feel that that's necessary to look at that in more detail. And a lot of people are worried about bothering their team, or they're worried about what might be found. But if you've noticed something, it's always best to get it checked out, because it may well be that it's nothing to worry about. But if it is an early sign of a breast cancer, the sooner that that's picked up and treated, the better the outcomes are. So,
Yeah.
and yeah, is there anything else you wanted to add to that, Jane?
No, I think you're absolutely right, Katie. It's really important to get changes checked out. I mean, we are hearing that sometimes people are having difficulty getting a GP appointment. There is information on the NHS website about getting a GP appointment and what to do if you are having difficulty. That might be sort of contacting the practice manager, or a lots of places do offer e-consults now as a starting point.
Yeah.
But you should absolutely be able to get an appointment with your GP. So yeah, don't be put off by not the thought of not being able to get an appointment, or B, you're wasting anybody's time, because it's really, really important to get these things checked out.
And sort of moving on from that, Fran's also so she has got an appointment next week at the breast clinic. So it sounds like she's probably found symptoms and been to her GP already and been referred to the breast clinic. But she said, I'm really scared. So
yeah, that's really understandable. To be referred to the breast clinic, which they do have specific systems for if they need to refer somebody more urgently. So it was the 2-week wait, which is still in some parts of the UK. There is now something called a faster diagnosis standard. And this is where people would get a diagnosis, so either cancer ruled out or diagnosis of cancer within 28 days. And the important thing to bear in mind is that the majority of women that do go to the breast clinic with a breast change do not have breast cancer. But what will happen is that you will be thoroughly assessed there. You will be seen by, quite possibly a nurse, a nurse consultant, a specialist doctor as well, where you'll have a physical examination, where you'll have, both breasts checked over, as we said, including the armpit and the up into the collarbone, an imaging, so taking pictures of within the breast. So again, that's where you possibly have a mammogram, an ultrasound. Some women might need an MRI. And sometimes that will lead on to a biopsy, where they will take an area of breast tissue that's sent off for analysis. And wherever possible, they do give you as much information at that appointment as they can as to what they think is probably going on. Obviously, you really need that tissue sample back once it's been assessed by the pathologist, before you can be sort of more definitive in the cause. But the treatment team, they know how difficult it is waiting for test results, and there are some things that they can say, well, this is suspicious of a cancer, or this looks like something called fibroadenoma, which is a benign, again, a non-cancerous condition, and they can tell a lot from those images. So not everything will lead to a biopsy. But it's understandable to be scared, and hopefully you can take somebody with you for support if that is what's going to help you. Again, we do sometimes hear from people that say they'd rather go on their own because they find they're just then managing that other person's worry and anxiety when they're trying to sort of focus on, needing the support themselves. They're supporting somebody else. But different things work for different people, and for some people it's absolutely the right thing for them to have that support of somebody with them. And there'll be the opportunity to ask questions. There'll be the opportunity to go through, all of the tests and why they're being done, and then sort of what happens next. But again, I would suggest, do by all means, Fran, give our helpline a ring, and we'll just talk through some of sort of strategies for managing that weight, because we can't tell you what's going on for you, but we can certainly help with what might help you manage that time while you do wait. Anything, Katie, that you can think of?
No, I think it is really natural to feel anxious at the thought of the appointment, and it's the unknown often, isn't it? It's that often people's minds will go off in all sorts of different directions, thinking about what it could be. And it can be really difficult to sort of contain that anxiety. So if you do know that you have strategies that work well for you, whether that's deep breathing or mindfulness or those sorts of things, that can be helpful to try and employ those, and also to sort of try and break it down into, there's nothing that you can actually do while you're waiting for that appointment or waiting for those results. It's not good. Nothing's going to change. And even if it was to be a breast cancer, and we're not saying that it is, because we don't know anything about your situation, Fran. But even if it was, breast cancers don't change that quickly. So you've done the right thing going to be assessed in the first place, and getting that answer, either if it's a reassurance, which hopefully it will be for you, or if it is a breast cancer, to get that treatment started as soon as possible for you.
Yeah, we've got, again, information on our website about referral to a breast clinic, what to expect at a breast clinic appointment. It goes through the things that we've sort of just talked about. So do have a look at that. You can look at it on the web. You can order a booklet form. Appreciate there might not be time for you, Fran, if your appointment's coming up to order a booklet, but it's certainly available, and it does describe sort of what to expect. And sometimes knowing what to expect and feeling more prepared can help you feel a bit more in control of what's going on, even if you can't control actually what the diagnosis is, or what the cause of the breast change is. So yeah, do take a look at that, but do give us a call. We're quite happy to talk through any of these things with you, as Katie said. And we've actually had a question in from Teresa that's she's post-treatment. So Teresa's 5 years since her operation. So it sounds like she's, a breast cancer operation. Do I get taken off the system, or can I still contact the breast care team still?
Okay, Teresa. So that's a good question. Normally with breast follow-up, and it does depend on your individual circumstances and how old you are, and what your diagnosis and treatment was. So usually you will have 5 years of annual mammograms, and follow up, in that way. If you're under the age of 50, that will continue until you are 50 years old. So if you aren't 50 yet, then you will continue to have that annual mammography. If you are over 50, um, quite often what usually happens is that you won't be having the annual mammography anymore, but you'll enter back into the breast screening system. So you'll be called back every 3 years. And as we said, you get called every 3 years from the age of 50 to 70. And following that, you can request your mammograms after that. So if you're over the age of 70, you would need to then request your mammograms yourself. You follow up varies again from place to place. So some people will be having appointments as well with their consultants, for a year or 2 years, sometimes for 5 years, depending on the protocols locally. But often it is what as we call open access follow up for the first 5 years. So if you notice a symptom in those 5 years, you can go back into your team without having to go to your GP. But after that 5 years, they should explain that to you, how you would access any further assessment if you needed it. But usually it would be going back to your GP.
Yeah, absolutely.
We've had another question come in here from Emma. She said, I had a clear mammogram in June, but I felt a lump. I assumed it was my age, so didn't think much of it. I was at my GP yesterday and she found a different lump than I had. I've been referred to the breast cancer clinic and there's up to a 6 weeks wait. I don't know how I'll get through it. I'm a worrier with health anxiety. I'm worried I have it and it's spread, causing secondary cancer, as I've had a lot of illnesses this year. Suspected arthritis, more recently stomach issues, and I was told it was probably IBS.
Okay.
So it sounds like you've got a lot going on, Emma.
Yeah, absolutely, it does. And again, you've done absolutely the right thing by going to your GP, even though you only had that mammogram in June. Just goes to show that you know exactly what we were talking about. So that's absolutely the right thing. Depending on how old you are, depends on kind of the type of referral that your GP will have done. So yes, I mean it might be worth finding out a bit more about what again if we can help you a bit more by finding out a bit more about your individual situation, Emma, by all means do give us a call, and we can ring you tomorrow, if you leave a message for us this evening. So it can be particularly difficult for people who do have health anxiety, and this is quite a common problem. So this is where people do you know, have particular anxiety about symptoms and sort of thinking that those symptoms are worst case scenarios. So thinking that they're cancers, and like you say, you've had some stomach issues and you're worried that it's spread, causing secondary cancer. It does sound like you've had quite a lot of illness and worries and different concerns. But you know, very often, you know, it will be an IBS or it will be another reason for those symptoms that you've got in your stomach. And your GP, I would imagine, has assessed all your symptoms. Again, I'm not quite sure why you've got a 6 week wait. If you're referred urgently, it would usually be sort of either within the on the 2 week wait pathway or under the faster diagnosis standard. Um, so, but what's really important is you get help with your worries and your anxiety. I don't know what you have, what support you have in place already. If you do have sort of a diagnosed health anxiety, what support you have in place. But what's really important is that you do get help with managing the anxiety while you wait. And that's something that again your GP can help you with. There is also an organisation called Anxiety UK who do have helpful information on their website about managing worries about health. Organisations like Mind have really good information about health anxiety, because what can often happen in a health anxiety is you can tend to sort of catastrophise and imagine the worst case scenario when there isn't actually the evidence to support that. And no amount of reassuring really kind of does take that anxiety away. So a couple of things, find out a bit more about the type of referral that you've had from your GP if you can do that, and also ask them to support you with your anxiety while you wait. Talk to us. I don't know if you've got family and friends that are supporting you. And do check out these other organisations like mine, like Anxiety UK. The NHS have a section on their website which is Every Mind Matters, which looks at sort of mental health support. So there's lots of things. Please do look into those things so you can get some support, however long you have got to wait.
Yeah.
Because if you've got a health anxiety, or even if you haven't, even a few days wait can feel like torture. So it's important that you do get support while you are waiting for that breast clinic appointment.
Yeah, and talking to your GP as well about the fact that you've been told it's a 6-week wait as well, to see whether there's anything that they can do to potentially expedite that, make that appointment come a bit sooner, or maybe to follow that up to see if there's been a reason that it's been that long. Unfortunately, we have heard a few cases, haven't we, on the helpline where people have had to wait longer than is recommended. But your GP might be able to help guide you on how to follow that up as well, and help to advocate for you.
Yeah, but do give us a ring, like I say, and tomorrow when we open at 9, or tomorrow at some point, or ring us this evening and leave a message, and one of the nurses will give you a call back
Yeah.
tomorrow.
Yeah.
So we've had Caroline has come in and said, fortunately, I was kept on the annual mammogram program at 50, as when I was 57, I got a recurrence 2 ops later, and I started chemo this week. I'm grateful to the doctor who kept me on the annual program. That's quite unusual, isn't it, Katie? I wonder if there was a particular reason, Caroline, why they felt that you needed to carry on with annual mammograms.
Yeah, it's not normal. Not normally after the age of 50, is it? But sometimes it does depend on the type of cancer that you had, and also on local protocols. So and it's good for you that they did do that. As you said, you're grateful that you've been picked up, and that they kept you on that program. And I hope you're okay now. If you've got any questions about starting chemotherapy, or if you want to talk to us about what that entails, again, please do call our helpline. And we also have an online forum where we have chemotherapy threads, and you can contact and get in touch with other people that are going through that treatment at the same time as you. So do have an explore of that if you haven't already, because there's a lot of support there, and it can help to connect with other people that are going through something similar.
Yeah, absolutely. Like you say, the chemotherapy monthly threads are often a really good way, because, it will be sort of September starters. You can join this, if you're September, October. So it is a really sort of supportive way of women sort of empowering each other and supporting each other while they go through the same or similar treatments. You might not all necessarily be on the same chemotherapy, but certainly going through it at a similar time.
Same time, yeah.
Yeah.
I've got a few people are coming in now. So Elizabeth has said, I spent 16 weeks waiting for the results from the initial appointment, where a very rushed biopsy was taken there and then, to the lumpectomy and sentinel node surgery, and now I'm waiting for axillary lymph node dissection results. I spent all this time worrying, and I'm not a worrier normally. I found a huge lack of support and information about what was going on and what to expect and treatments, etc. I live on my own and have grown children that live away. I'm due to start chemotherapy next Thursday, and I'm terrified about what to expect and how I will cope living alone. Can you point me in the right direction for support and what to expect? Oh, Elizabeth, I'm sorry you're going through all of this, and it sounds like you've got a lot on your plate as well. I mean, as we were saying earlier, the chemotherapy threads on the forum might be helpful for you. Our helpline, we're very happy to talk to you and to sort of help you sort of plan for what's going to happen with the chemotherapy. I'm wondering if you've got a breast care nurse that you can talk to, who can maybe explain a little bit about what to expect with chemotherapy. They should have given you a hotline number and some information there as well, but we have an awful lot of that information on our website as well. and we can more than happy to signpost you there if you give us a ring, and we can share the information with you.
Mm.
But it can be quite daunting and overwhelming sometimes when you're facing things that you don't know very much about, and the thought of it can often be very frightening, as you say.
Mm, mm. There is support out there though, Elizabeth. So you know, although you may live alone, don't feel like that you'll be going through it on your own, because like we're here, we've got some amazing support services. We've got a service called Someone Like Me, so we could put you in touch with another woman who had perhaps had a similar diagnosis and a similar treatment, and also perhaps lived on their own, and we could arrange for that person to give you a call. You might have just one call with them, you might have a few calls over a period of time with her, and it's that ongoing support of, you know, that real peer support of speaking to somebody who's been through what you're going through. So you know, these are people that are trained volunteers for breast cancer now, and they've um, been through you know, a whole variety of different diagnoses, different treatment pathways, different social circumstances. So you know, you're not on your own. So do make use of us. There's
Mm,
lots of things that we can help with. We have lots of services, like Katie mentioned, the forums, but and the helpline. Also, yeah, Someone Like Me is a really popular service, understandably, and lots of people get real benefit from talking to somebody who's been through what they're going through. um, and it's just sort of normalizing that, you know, what you're feeling is absolutely
yeah.
natural and completely normal and understandable. um, so yeah, reach out, give us a call, 0808 800 6000, and we'll talk all this through with you. That's absolutely what we're there for. So yeah,
Yeah.
please do give us a call.
And depending on whereabouts you are in the country as well, you may find that there's other support around, and
Yeah,
your breast care nurse might be able to direct you to anything that's local to you as well. But often there's Macmillan centres or Maggie's centres around
yes,
that have a lot of local support, and sometimes complementary therapies and things like that that can be really,
yeah,
really sort of supportive for you, and can help sort of ease that anxiety at times.
yeah.
So it is worth asking your breast care nurse what is available in your local area, if you have a breast care nurse that can sort of explain all of that to you.
Yeah,
Um,
definitely, definitely. And Leslie's is just made the comment, which is lovely. Really, it's lovely to hear, because you know, it can be quite challenging going through treatment on the NHS. We know that there's lots of different difficulties and stresses and strains on the system. But Leslie said the NHS are wonderful. Got diagnosed on the 1st of September. Lump and lymph nodes removed on the 10th. Just waiting for radiotherapy to start.
and that's good to hear that you've got a positive experience, Leslie. Because sometimes we you're right, we do hear a lot of experiences that maybe aren't necessarily as positive as that. But it's good to hear that you are being well looked after.
Mm,
And if you do want any more information about radiotherapy, or you want to talk to anybody that's been through that, you can, as I said, always speak to us on the helpline, or contact our Someone Like Me services as well, and we can put you in touch with people. But I'm glad to hear that
mm,
you're getting the care and support that you need at the moment, and I wish you
mm.
well.
And the other service we have for people that have come to the end of their main hospital treatment, so perhaps something, Leslie, if it's radiotherapy, and that then, you know, you might be on hormone therapy or something like that. We've got a service called Moving Forward. So for people, like I say, who've come to the end of their main hospital treatment, um, it's to help sort of empower people to move forward with more confidence after their
Hmm.
diagnosis. We do have dedicated services for younger women, so women under the age of 45 with breast cancer, and also dedicated services for those women who are living with secondary breast cancer, metastatic breast cancer. So this is when the breast cancer has spread to another part of the body, and the treatment is very much aimed at controlling the cancer and controlling symptoms and improving quality of life, rather than um, with a curable intent. So we do have dedicated services for people living with metastatic breast cancer, and another one for younger women living with metastatic breast cancer. So we do offer a whole range of different support services. And I think we're probably coming to near to the end, Katie. The only thing I was just going to mention, which we've not really got round to mentioning, is the um, place of artificial intelligence in breast screening
Oh
now.
yeah.
So the artificial intelligence is kind of everywhere now, it would seem, and there's some really interesting research, and the UK has launched an AI study called Edith, which is about detecting breast cancers earlier using AI, using artificial intelligence. So you
Oh,
how what we really want to hope and see at breast cancer now is a quicker diagnosis, earlier diagnosis, and people living, with better outcomes after a diagnosis. So,
yeah.
um,
And
yeah,
hopefully, in some ways, that moving forward with that research in the future, they'll be looking at maybe sort of triaging, using the AI to help triage patients. And I think they do that in some areas already, where you can triage CT heads, for example. And if
mm,
the AI notices something that needs to be looked at more quickly, that they will be put to the top of the pile to be read by humans, as it were.
right.
So, and that's what I think in the future there definitely will be a role for AI. It's not going to
Mm,
replace human
no,
readers, but it will make
no,
things more efficient, I think, and easier
yeah,
for the workforce too. So
yeah,
yeah,
absolutely, definitely. So I think we've probably come to the end of the questions, unless you can see any, Katie, that I
I
can't.
can't see anything on my screen.
No, okay. So just to mention that our next Facebook Live is on the 2nd of October, which is a Q&A with our colleagues Louise and Catherine. So that is, unlike this, which is more of a themed session, although obviously people are welcome to ask anything. That is a Q&A session. So any questions you've got, by all means, do join Catherine and Louise on the 2nd of October for that. And yeah, so just thank you ever so much for joining us. I hope that's been of some help. Like I say, anything else that we haven't got to, we will get to tomorrow morning. And by all means, make use of us. That's exactly, like I say, what we're here for, Breast Cancer Now.
yeah.
Good night.
Have a lovely evening, everybody. Good night.